I just wanted to have a quick chat about the neck before we get into the techniques. And that the neck, when you look at the longitudinal connections of the neck throughout the entire body, when you're treating it, it's going to have effects everywhere. When you think of the most common kyphotic posture, when I go into that posture, it can also cause this kind of anterior hip rotation. It can put pressure on the organs. So when you pull that back, it's going to encourage the hips to pull back, the psoas to slacken. You got to think of this in the entire body when you're thinking about treating the neck. And while I greatly respect any chiropractor or osteopath, for any of those high velocity, low amplitude thrusts to really take effect, the soft tissue has to be balanced. And I'm not only saying that because I'm a Libra, but to think of how there's a kyphotic posture, to balance out the suboccipitals, to get in the laminar groove and lengthen all that tissue off, and to make sure that there's a balance in this entire cylinder and structure is going to help with not only massage, but with other modalities as well. And this may be a controversial opinion, but I truly believe that if you're good enough at working on the neck with the soft tissue, connective tissue, that there's no need for those high velocity, low amplitude thrusts. You can get the job done with simply some joint mobilizations and working in a structure that is actually quite sensitive. When you look at the cervical vertebrae, they're very tiny. The nerves that run off, everything about this area is sensitive, but its effect on the body is quite powerful. And when we look at the neck, there's 26 muscles to consider here. And one thing to think about is what each of them need. When you look at the upper traps, how big are those muscles? What kind of pressure can they withstand? When you're looking at treating the anterior scalene, what do you want to do there? Does it require more of a precision, fine-tuned touch? And also with the suboccipitals, how is that going to affect the neck's posture? What kind of pressure do they need? Does it require more of a traction and then just a nice little pull? It's good to think about each little muscle in this kind of sling and cylinder around your neck, and you're trying to do these really specific techniques for each muscle. To do the same pressure on every single area, it could work, but I prefer to think of what each muscle can withstand and what it needs to be balancing the neck in a healthy way. The neck is a sensitive but also very powerful place, and that's important to keep in mind when you're doing these techniques. Most people are going to have a kyphotic posture, so they're going to be like this. So the focus on all these techniques is a systematic approach to ease that off and to bring it down. We'll be working on rotation, bringing the anterior scalenes down, the suboccipitals up, and also releasing trigger points in the upper traps that create even more kyphotic fear patterning. And when we do all of that, it's going to create a sense of ease and make sure that the client or athlete is going to be able to sleep better and perform better. Now that we're on the neck, I'm going to show you guys a couple of active style releases. So for this one, what I'm going to get Jeremy to do is to keep his head on the table and turn it 90 degrees. And as he does that, I'm going to work in through the superficial cylinder of the neck. So basically I'm going to place a fist right here, and then I'm going to get him to slowly turn his head. And as he does that, I'm just kind of over the skin, just gently over the tissue, and then I'm working around and into the upper traps. We'll do that one more time. This is a nice way to start on the neck and to open up around the cylinder and just create more range of motion. So here, I'm getting Jeremy to bring his head along the table, 90 degrees. And as he does that, I'm stretching out. And when you get to the upper traps around this area, you can provide a little more pressure, but then as you go lower, you just want to ease off just a little bit and focus on the stretch that you're creating in the tissue. Another nice technique you can do here at the neck is to bring both your fists underneath the upper traps, kind of gather the tissue,
and then twist and spread everything out here. And that feels really nice. You can even go along the clavicle, take your fingertips, and just get a nice little specific technique there to break up those adhesions. And then one thing that's good for athletes is to, once again, work on the breath. So the diaphragm is the primary driver of breathing, but the anterior scalene is actually the second part and does play an important role. So with this, I'm going to get Jeremy to bring his legs up, knees bent, and that just creates a bit of ease here and allows his cervical spine to drop onto the table. And as that happens, what I'm going to get Jeremy to do is to turn to the side. And with him, you can actually clearly see the sternocleidomastoid muscle. What you want to do is go underneath that to find the anterior scalene. So I'm bringing Jeremy back. And this can be quite a contentious technique. You don't have to do it, but if you can do it, it is something that's very worthwhile and will help the client breathe just a little bit better. So I'm just going to get you to take a deep breath in. And then on the out breath, I'm just going to go underneath the SCM. And you're just going to find this nice little, you'll feel this kind of crunchy bit. And what I'm going to get Jeremy to do is to step his feet down and bring his chin down in towards his chest as I stretch down the anterior scalene into its attachment on the first rib. Okay, Jeremy. So I'm just going to get you to take a nice deep breath in. And I'm going to get you to press your feet into the table. And as you do that, bring your chin in towards your chest. And as he does that, I'm slowly bringing the muscle down into the first rib. And once again, getting underneath, you'll feel this kind of like crunchy guitar string type band. And then I'll get him to step down, chin to chest, and I press down into the first rib. Another technique you could do here that feels really nice is to do a taffy pull. So you're going along, I'm just going to get you to turn your head here, Jeremy. So you're going along either side of the cervical spine in the laminar groove, and you're just stretching up into the suboccipitals. So as you can see here, I'm gathering the tissue, and I'm just stretching up along the laminar groove into the suboccipitals. And how you're going to do this is you're going to pull from one end and then the other hand. So I'll start with this hand, and I'm going along the cervical spine. And this is one that they're definitely going to ask you to do more of because it feels fantastic. So I'm taking my fingertips, I'm just in the laminar groove, and I'm spreading the tissue up into the suboccipitals. Switch hands, and then I'm pulling up with this hand into the suboccipitals, and then once again dipping in, crossing over just along the cervical spine, and I'm going up the laminar groove. I'll show you guys one more time. So then I'm sliding up, and I'm just going up the laminar groove into the suboccipital muscles. Speaking of the suboccipitals, we're going to talk about them now. So what I'm doing here is I'm going to go up either side of the cervical spine once again in the laminar groove. And Jeremy, I'll just get you to bring your head up, and I'm just going to drop my hands down, and then I'll get you to rest your head on my arms. And with this, my fingertips are in the laminar groove just on either side of the spine, and I'm slowly pulling up. And once again, his legs are up, his knees are bent, and that just creates some space for the cervical spine to rest against the table. And then as I'm pulling up, I'm just really slowly, not a lot of pressure here. The neck is a sensitive place, and the muscles don't like a lot of pressure in this area. And as I reach the top, where I am right now, which is in the suboccipital muscles here, I'm going to drop down into the table with my hands and then pull up and traction the muscle up. So once again, I'll get him to bring his head down and place his head in between my arms. And then I'm slowly pulling up on either side. You can do some nice kind of circular motions here. So once again, Jeremiah, look at these, rest there. So you can do some nice little like circular kneading as you go up. And once again, you don't want a lot of pressure here. This is a sensitive area. The neurovascular bundles that move off the spine are there. And if you provide too much pressure, you're definitely going to make the client not like you. So with this, slowly spreading up, and then I'm dropping down into the table, and then lifting up and stretching out the suboccipital muscles. A nice technique here, something that isn't really talked about a lot, is that the mastoid process, we all know, its importance with the SCM. So you can treat down and just kind of like comb out the tissue down into the SCM. But one thing that I like is when you're going up this area, you can kind of spread the tissue out and you're just kind of easing that tissue around this area. And if you do find that a client has a lot of tension in their SCM and you're finding that it's hard to release it, you can once again do strain counterstrain. So you can get them to kind of bring their neck into that position of ease, which will take the tension off the muscle here. And as you do that for about 90 seconds, just do some nice circular movements. And when they're in that position of ease, it will just allow the muscle to unhook, and you'll find that it will help to soften everything in the area. And since I talked about strain counterstrain here, we can also mention that with the upper traps. So if anyone has a trigger point here that's particularly bothersome, what you can do is take their head and once again, bring them into the position of ease, which takes out the slack here and allows the muscle to relax. And as they do that, you can take fingertips, thumb, whatever you want to use. So here I'm just going to use my thumb. And as I bring him into that position of ease, you really start to feel the muscle soften up. And you can hold there. And this will just allow the trigger points to release a lot faster. And then once it has released, a nice thing you can do is to do a pin and stretch. So you can hold that area. And then as you do that, bring his head to the other side and stretch out the trigger point that you just released. And as I've been talking through this entire course, you guys know that I like to make things as easy as possible. So with this, you're killing two birds with one stone. You're releasing the trigger point in more of a fast time. And then after you're done that, you can stick in that area and do the stretch at the same time.
There's an old sports psychology quote. It says, if you don't have confidence, you're always going to find a way not to win. Carl Lewis said that. And when you think about kyphotic postures, it's this, you're rounded forward. Now, to me, this is not a posture of confidence. So as we're working our way through the pecs and we're easing that off, we're bringing the tissue up and we're adjusting the shoulder back. This not only exudes more confidence within yourself, but it also shows your potential competition that you are there, you're ready, and it shows them that you are very confident in what you're doing.
So next up, we're going to talk about the pecs. And what I like to do is get the client to come to the edge of the table, and that allows their arm to go up like this. And the reason why I like to do that is because it creates a little more space. It allows for more movement as I want to do active releases in the pecs. And it's creating just more ease for the client too to have their arm up on the table as we continue forth with the technique. So here what I'm doing is I'm placing my fingertips down on the pec major and I'm thinking directionally. So I want to pull the shoulder back. Most people have a kyphotic posture, the shoulder is pulled forward. This is creating issues with synovial fluid in the area. This area is being compressed and it's decreasing range of motion and performance. So with this, I'm just taking my fingertips and I'm going upwards and I'm stretching out all of the tissue and just going down into the shoulder. You can even follow that along past the deltoid into the bicep. So you're getting a stretch down the entire fascial line and chain, and it feels really fantastic. And you're covering more ground in a quicker manner. So you can do more during the course of a treatment as opposed to setting up all these different techniques. Another way to do this, as opposed to using your fingertip, that might be easier on you as a therapist, is to use your fist and you're sinking in. And once again, you're not like putting a crazy amount of pressure down. The focus here is on stretching up. So I'm pressing down and I'm stretching up from the pec major into the anterior deltoid. And this is a really fantastic technique. And it's one that you're going to have to do on most athletes to bring that shoulder back. The reason why I like this position too is that after you've done kind of spreading out through the pec, through the bicep, you can actually take this to work on the forearm and hand. So with this, you can kind of just like anchor down and stretch up the forearm. I like to use a fist here and just get the whole width of the muscle. And as you can see, as I'm anchoring down with this hand and spreading the fascia and connective tissue up with the other hand, you can see in his arm just all of that tight tissue. So I'm just going to spread this out and you're just creating a nice stretch in the forearm. Also, working on the carpal tunnel and hand from this angle is really nice. So I'll take my knuckles and I'll just spread out in the carpal tunnel along the thumb and just getting a nice stretch in there. You can even use your thumbs and just press down. I kind of like to use my thumbs. I know some therapists don't like to use their thumbs a lot because it can wear them down, but you know, I've been doing this for a while and mine still work. So this is what I like to do. And I think it allows for more of a specific approach because you can feel everything that's going on. You can spread down the hand into the palmar surface. A technique that I really like here, and one that kind of accentuates what we just did, is to do a nice oscillatory technique for the shoulder. So here, what I'm getting Jeremy to do is bring his arm up, and then I'm placing my thumb on his hand, and my hand's here. And then I'm just kind of tapping. So I'll get you to relax your arm. And then I'm creating this nice oscillation. And you can even place your hand here and feel that there's a bit of movement. And that just helps the synovial fluid in the area to flow a bit better. And you're kind of lubricating the joint. And you just do this for 30 to 90 seconds. And while it doesn't look like it's doing much, after you've done all those movements in through the pecs, opened up the bicep, the deltoid, that's when it's really nice to deploy this technique. And it'll just help the client have more ease and fluidity in movement. I'm going to show you guys a nice technique for the anterior deltoid and down the arm into the extensors. So I'm going to get Kristen to place her arm down like this. And then what you're going to do is you're going to place the flat of your hand down on the anterior deltoid. And you're just going to push it down slightly so that the shoulder is back where you want it. And as you can see, that raises up her arm. So what we're going to do is anchor down here and then anchor down right over the extensors. And then with this technique, you're slowly pulling down, and you're moving at the same rate with both hands. And this is a great way to stretch out in through the top of the arm, the extensors. It's a great way to bring the anterior deltoid down. So once again, anchor down here, and you're slowly stretching. And your mind is on bringing this down and then pulling all of this fascia and connective tissue down this way and creating a stretch and lengthening of everything in the area. And just move at the rate at which the tissue allows your hands to move. And as you move down into the wrist, you can soften your touch. And you can even pull in through the elbow here and just get a nice stretch over this area as well. Continuing forth after you've done the arm and stretch everything out down this area is to work underneath the clavicle and in this area. So basically what I'm doing here is I'm bringing my fingertips underneath the clavicle and I'm breaking up any adhesions, and you're just slowly carving everything out here. You can stretch and just do a nice connective tissue fascial stretch into the anterior deltoid and down farther into the pec. And you're just working with sequencing here. So we're loosening up this entire chain and we're trying to drop the shoulder down. And this is also good for anyone with TMJ pain. So I'm just going to show you an osteopathic technique. I'm going to bring this hand out of frame. So you just pinch the clavicle and you're finding the direction of ease. And with Kristen, I can tell that this is where the clavicle wants to be. So I'm keeping it there. And as I'm doing this, everything is just unwinding the nervous system, the soft tissue. You can even work with the breath. So deep breath in and slowly out. And how does that feel, Kristen?
Relaxing.
Yeah. Sometimes these holds are really good. It just allows everything in the area to relax. Continuous movement can actually disrupt the mechanoreceptors and can be irritating. So you need to know when to move and when to stay. Okay, so to round out the sequence for the anterior deltoid, TMJ pain, we're going to continue into the sternocleidomastoid. So we've lengthened this area, we've stretched this out, we've eased off the clavicle. Now after this, a really amazing thing to do to drop the neck down and out of that kyphotic posture is I'm going to get Kristen to turn her head 90 degrees. And as you guys can see, the SCM pops up, we can see it. And then I'm going to get her to gently press up into my hand for 10 seconds, really gently. We just want to trigger this muscle. And then I'll get her to relax. Take a deep breath in through the nose. And what I'm doing here is I'm not putting pressure down in this area. I'm using a soft fist. I'm using this part of my knuckles. And then I'm anchoring down at her shoulder. And then I'm stretching up all of the connective tissue and fascia. And I'm moving it up just past the mastoid process. And you're lightening your touch as you get into this area. But I'm going to say that you want to move up into the scalp, over the bone, and it's really important because everything's connected. This is all continuous. The scalp, the mastoid process, SCM, clavicle, and that's why we're doing it in this sequence. So once again, when you're doing this, you're pulling up And your focus is on pulling everything up superficially. You're not pressing down into the neck. That would be, not good. So basically, once again, you can even combine a muscle energy technique with it. So I'm going to get Kristen to press up into my hand, just gently, and do that for about 10 seconds. Relax. Deep breath in through the nose, and slowly out through the nose. Anchor down the shoulder. On the out breath, your focus is on pulling the tissue up into the mastoid process. And just past it, you lighten your touch a little bit here. And you go right up into the scalp. And this technique is fabulous because it helps to drop the anterior neck down and create a nice stretch here. Anyone with vertigo, this is also incredible because things get so tight and bound up in this area. And you just want to make sure that you do it on both sides. Okay guys, so I'm going to show you a different angle here. So I'm going to get Kristen, turn her neck 90 degrees. And then once again, I'll get her, place my hand on her head and get her to gently press up. And I'm just getting her to fire this SCM right here. I'll get her to relax. And then get her to take a deep breath in. I'm anchoring down her shoulder. And then on the out breath, I slowly am pulling up the length of the SCM. And then in past the mastoid process into the scalp.